petitioner is at 31 minutes, 14 seconds of the 50. You can call your next witness when you're ready.
Your Honor, petitioner calls Dr. Michael Medchill.
All right. Doctor, if you'd like to bring water with you, you may.
Did we swear him already? We did. Good morning, Dr. Medchill. State your name, please.
Dr. Michael Medchill.
We have about 15 minutes, so I got to go really, really quick here. I know you're retired now. Can you tell the court what you did before you retired?
I was the chairman of the Department of Obstetrics and Gynecology at St. Joseph's Hospital. I was in private practice at the same time, and I was also on the teaching faculty of the Phoenix Integrated Residency Program in Obstetrics and Gynecology.
Okay, so you have a medical doctorate degree,
Yes,
and you practiced medicine in Arizona for about 30 years. Is that right?
that's correct.
And according to the Arizona Medical Board, it says that you were first licensed in Arizona in 1992, and your medical license expired on March 7th, 2022. Is that accurate?
Yes,
It's about 2 years ago. And you retired from medicine in good standing with the medical board?
that's correct.
Your Honor, I tender Dr. Medchill as an expert in the area of obstetrics and gynecology.
All right, so stipulated.
Okay. Dr. Medchill, in front of you there, we've got your CV, I guess. This is exhibit A12. And everything in your CV is accurate?
Yes,
Is that up to date and current?
yes,
Okay. And like you said, you served as the chairman of the obstetrics and gynecology department at St. Joseph's Hospital in Phoenix.
yes, for 4 years.
In that capacity, how many children did you personally deliver?
I delivered over 20,000 babies.
And I think when we were talking, you explained that the success rate of a pregnancy when a woman becomes pregnant and then delivers a baby, not all of them make it. Is that right?
Almost half of all pregnancies end in a miscarriage.
Okay. And so if you delivered 22 or 20,000 children, how many patients did you see that didn't deliver healthy babies? Goes directly to I'm sorry?
Sustained.
In addition to women that did not deliver a healthy baby, in addition to women who delivered healthy children, did you have patients who had miscarriages?
Thousands.
And so you have extensive training and experience with regard to women that have non-normal pregnancies.
Correct.
All right, Dr. Medchill, in your report here, which again is Exhibit A12, you summarize. There's a written report and it's going slow. Let me see here. Did you review some records as part of your retention in this case?
Yes,
And your report has an index of exhibits that you looked at. There's a Banner pregnancy test, an image of some tissues. They're all attached to your report. Other than what is listed there, did you review anything else?
just the ones that I've listed.
Okay. And after you performed that initial review, you asked for some medical records. You had a question regarding medications.
Yes,
And did you get those records?
yes, I did.
Do you recall where they're from?
From Barrow Neurologic Institute.
You're familiar with Barrow.
Very familiar. They're at St. Joseph's Hospital.
That's part of the
With over 99% probability.
Okay. And can you explain what facts support that conclusion? The facts that you considered anyway.
I am kind of the Sergeant Friday of Dragnet. I only take in the facts, the bare facts that are known to be provable. Number one, there was intimacy of some type, disputed what exactly it was. Number two, she had a positive pregnancy test at a lab at Banner, which means that there's a 99% chance that that's a positive pregnancy. Number three, she had a negative test or little or no fetal DNA found on a test in late September looking for fetal DNA in the blood. What that tells me is that by that point at the end of September, the pregnancy had failed, that even though she still had a positive pregnancy test, it was no longer a viable pregnancy. The fourth thing is that she still had a positive pregnancy test in the blood of 102 on October 16th, which again, greater than 99% positive that she was pregnant. And the fact that between June 1st and October 16th, she's got 2 laboratory proven pregnancy tests. That indicates that all of the urine pregnancy tests, any other pregnancy tests that she had done, likely are also demonstrably positive. And the final thing is when she had bleeding in November, and then a couple of days later had a negative pregnancy test at the mom doc. It also illustrates, one, that the pregnancy finally was completed. So what happened was she had a pregnancy. It failed at some point. There's no way of knowing exactly when. Frequently, very frequently, when people miscarry, they're incomplete. Some of it miscarries, the fetus is no longer alive, but you still continue to have a positive pregnancy test because there's still tissue there that hasn't been expelled. That finally happened in November when that pregnancy was completed, when that miscarriage was completed.
Okay, Dr. Mitchell, Mr. Echard has said that he doesn't believe that a pregnancy was possible here because there was no intercourse. Do you have an opinion about that?
Uh,
Regarding general, not regarding him or her, but in general.
Well, it's said that men are like basketball players. They dribble before they shoot. They also dribble afterwards. And if you are rubbing genitalia together, it is possible to get pregnant.
How much weight would you assign to the fact that Mr. Echard denied sexual intercourse? Is that significant to the question of whether she was pregnant, or is it a minor point?
It has nothing to do with whether she was pregnant.
Hold on 1 second, counsel.
I'll withdraw.
Withdrawn.
I'll
Okay.
withdraw. Dr. Mitchell, I think you said earlier that it's impossible to know for sure when Laura's pregnancy ended. Do you have an opinion about, based on the records that you've seen and the information that's been provided to you, do you have a theory about when?
It actually ended in November when her pregnancy test was negative. When it failed, in other words, when it was no longer viable, there is no way of knowing exactly when that happened.
Dr. Mitchell, somebody online, I think, made a comment, theory obviously, that Laura may have injected herself with HCG. I think that we talked about a trigger shot or something like that. First of all, what is an HCG trigger shot?
It's used in trying to help somebody get pregnant, and it's by prescription. It's an injection, and I saw no records that indicated that anybody would have given her a prescription for HCG.
Okay.
Or would there be a reason to give her one, especially if she was already pregnant?
Right. Dr. Mitchell, Clayton, in his pretrial statement, objected to your testimony on a couple of grounds, and I know you and I talked about this. I'll just read one of his objections, that you have relied on an admittedly tampered with data set. Do you feel that you've relied on admittedly tampered data in any way, shape, or form informing your conclusions?
Absolutely not. All I've included were the fact that they both admitted that there was some type of intimacy, that there were all the other things that I used to make my decision was based on laboratory tests.
And the Planned Parenthood sonogram that we've spoken about, and I think you were sitting here and saw and heard that testimony. Did you rely on that Planned Parenthood sonogram in any way?
No.
And the HCG test from any lab test now that Laura did not send to any court, the one that said 130 something thousand, did you rely on that in any way?
No.
Does the fact that Laura has those credibility problems and that she did some things that we all agree are dumb, does that change your opinion on whether or not she was pregnant?
No.
Why not?
The lab tests, like I said, are 99+%, and they were repeated over and over and over. And so she was pregnant.
One other objection that Clayton made to your testimony, Dr. Medchill, is that you, with zero scientific or DNA basis, made a conclusion that Clayton was the father of twins. Have you reached that opinion at all?
No, that's
I mean, I don't see it in your report. I'm just wondering if you agree that you can't make any conclusions at all because we don't have DNA.
correct.
You're familiar with the RAVGen test process.
Yes.
Can you think of any reason why a woman who is not pregnant would want to take a test like that?
Objection foundation.
Sustained.
Dr. Mitchell, if Laura was not pregnant and she submitted a sample to RAVGen, would RAVGen be able to confirm that she wasn't pregnant?
Objection foundation.
Sustained.
Dr. Mitchell, you're familiar with RAVGen. You just said that.
Yes.
Did you ever use them in your practice or something like that, a similar service?
Yes.
And as part of using a DNA testing service like that, does the service confirm that the woman is or isn't pregnant? Can they come back and say this woman's not pregnant?
Objection foundation.
Sustained.
Did you ever have that happen? When you used DNA testing as a doctor, did you ever have a test come back that said a woman was not pregnant?
Objection foundation. And also RAVGen's only been around for a few years, and I think it's been retired for a few.
I'm asking about the process generally, Your Honor.
Overruled. He can answer the question.
Pre-cell DNA, which RAVGen is a type, has been around for a number of years. I used it frequently. It not only tells you if you're pregnant, it tells if it's a boy or a girl. It'll tell you if it has genetic defects. It's incredible. It's the biggest, best new technology that we've had in the last 20, 30 years.
I was looking at my notes when you answered. So a RAVGen type test or RAVGen itself can tell whether it's a boy or a girl?
Yes.
Can tell, well, then necessarily can tell whether the woman's pregnant at all?
Yes, obviously.
Okay. Dr. Mitchell, one final question, one series. Can you see the picture behind you there of
Yes.
Laura's body? As a physician and as a man or doctor who's delivered lots of healthy babies and maybe some that didn't end healthy, can you explain how Laura's body could be that size? And she never said that she passed any dead fetus. Objection. Exceeds the scope of his presentation. You didn't review the photo as part of the exhibit.
Overruled. He can answer if he has an opinion. The court will give it the weight it deserves, which could be a little, a lot, or none at all.
That photo is actually one of the things that. Did you look at this photo as part of
I
your
saw
review?
that photo earlier. Yes.
And regarding the size of Laura's belly, which clearly is not here anymore, does that show you anything regarding whether or not she was pregnant?
It could indicate that she was pregnant. Could indicate other things.
The fact that Laura didn't claim to pass a large fetus, is that something surprising to you, or is that something that could logically be explained medically.
The fact that this pregnancy, in all likelihood, was no longer viable early in this pregnancy doesn't surprise me that she didn't pass much tissue at all.
How does that happen? Does the body?
What happens is the fetus starts to grow. At some point, the fetus stops growing. There's no longer a heartbeat. If it's very early, they may just get a period. If they miscarry, they may pass a little tissue, maybe not. And some of that tissue remains enough that it continues to produce HCG. That's why she continued to have the positive pregnancy tests. And that's why we call it an incomplete abortion once we know that there's no longer a viable pregnancy there. But the pregnancy doesn't end until all that tissue is gone, at which time it is a completed miscarriage.
Okay. 2 more questions, Dr. Medchill. Have you reviewed the expert report of Dr. Deans, who's Clayton's expert?
Yes.
Do you disagree with anything that Dr. Deans said?
Not really. The only thing that was amusing to me was the fact that they're relying on a clinical pregnancy. There's an old adage, either you're pregnant or you're not. The adage isn't you're either clinically pregnant or not. And the reason for that is because to be clinically pregnant, that means you have to have prenatal care. Laura did not have prenatal care. I took care of hundreds of women who had no prenatal care. So technically, were not clinically pregnant, walked into the hospital, and I delivered a 9-pound baby, even though they weren't clinically pregnant. Clinical pregnancy only means that they've gotten prenatal care that you could see on ultrasound or you could hear with an instrument. And so a clinical pregnancy is not relevant here. It's either you're pregnant or you're not.
And your opinion is that Laura was pregnant, even if it wasn't a clinical pregnancy, she was pregnant.
Correct.
Thank you. No further questions.
All right, Council, you're at 45 minutes and 43 seconds. Council, you have 28 minutes, 46 seconds.
Thank you, Doctor. You consider yourself a scientist, correct?
Yes.
So you know that when collecting data, it's garbage in, garbage out. If you're not relying on good data, the opinion you're going to give is not going to be credible. Is that correct?
That's why I only relied on the data that I thought was totally credible.
And that was the data that Mr. Gingrich gave, correct?
That was the data that was presented to me.
I saw when you drove into the parking lot, you walked in with Laura's mom in the parking lot. Are you friendly with her mother?
Yeah, I just met her this morning.
Okay, that's nice. Did you, well, let's go here. Mr. Gingrich asked you whether or not you relied on the ultrasound, but you're aware that the ultrasound was a fake, correct?
I've been told that, and that's why I didn't rely on it.
Okay, but knowing that the ultrasound was a fake, doesn't that cause you to be incredulous about the other data that Ms. Owens presented you?
That's precisely why I only used the data that was laboratory proven.
Well, you actually sat in here and are relying on a photocopy or a picture of a medical record that Laura gave. That was the banner with the 3 colors of highlighter. Do you remember seeing that? You were just sitting there.
Yeah, I saw that, yes.
You understand, Laura has admitted to faking medical records.
Yes.
She faked ultrasounds by putting other lab names on them. She faked the 2 versions of the HCG test that you relied on, correct? Objection. That's exactly what she
Overruled.
testified
Can be
to.
addressed. It can be addressed in redirect.
You know
The data that I relied on was stuff that was verified from the laboratory itself.
that's not true. You relied on a photocopy that Laura took a picture of and provided you. It's in your file.
The Sonora Quest test on October the 16th was, I believe, derived directly from Sonora Quest.
Okay, let me
I
pause
think
here. Does it concern you as a scientist that 3 men have accused Laura of fabricating medical documents?
that has nothing to do with the data.
Does it concern you as a, it doesn't have anything to do with the data? It doesn't mean that you should do a deeper dive to verify the authenticity of the data?
If you have proof that the test from Banner or from Ravgen or from the quantitative HCG were fake, I'm willing to take a look at them, but that's what I have.
But doctor, we have proof. She changed the sonogram and she changed the HCG levels in one of the tests that you relied on.
I didn't rely on the ultrasound, and I didn't rely on the faked 100 and whatever thousand.
Okay. You know that Laura testified that she, well, we can agree, you reviewed absolutely 0 records from Laura's PCP, correct?
I don't know who her PCP is.
Well, that's a problem. Wouldn't you have wanted to talk to her PCP and see what drug she was on?
I saw what drugs she was on from Barrow.
No, you saw what drug she was on from a neurologist that she had telemed visits. You didn't request, doctor, records from her PCP, correct?
I did not.
And you would agree that, thank you. You would agree that it would have been helpful had you reviewed her historic gynecological records, correct? Correct?
The testing of her, whether she was pregnant or not, had nothing to do with her gynecological
You have
records.
no idea whether or not she had elevated HCG in her system in the years before with any of the other medications, do you?
The fact that she had a negative HCG at the end of her pregnancy tells me that she didn't have familial HCG in her system.
Okay, doctor, let's really quickly talk about other things that could have caused Laura's HCG to be elevated. As a physician and a scientist, you would agree that HCG could be elevated due to pituitary, correct?
Yes,
It could be elevated due to cancer, correct?
yes,
Ovarian cysts.
depending on if it was cancer.
You're aware that Dr. Yi and Dr. Chan both provided medical record, but both indicated that Laura had ovarian cancer.
I saw those records. I didn't.
I'll move on. Let's go back. It could be elevated HCG could be caused by weight loss drugs.
I'm not aware of weight loss, but there are drugs that can alter HCG results.
Let's talk about that a little bit more. How about anxiety medication?
Yes,
How about antidepressants?
yes.
And you have no idea whether or not Laura was on any of those medications because you didn't review her historic medical records other than what was provided to you by telemed at Barrows, correct?
I saw that she was on some of those medicines,
What medicine?
the anti-anxiety medicines.
An anti-anxiety medicine that you just said could elevate her HCG. Last, doctor. IVF drugs also cause escalated HCG, do they not?
Certain types.
Laura could have been on Novorel or Pregin, correct? Pregin.
I saw no records of that, and there would be no reason why, if she was pregnant, that she'd be on those.
One last question, doctor. The antipsychotic clozapine causes elevated HCG, does it not?
It's been reported to.
Thank you, Judge.
All right, redirect.
One question, Dr. Mitchell, regarding the potential of some issue other than pregnancy being the source of Laura's HCG in her blood. Are you aware that after November 14th, or on November 14th, she tested negative twice?
Yes.
If Laura had drugs or tumors or cysts or anything else that was causing an elevated HCG level, would she have tested negative for pregnancy twice on November 14th?
No, it would have still been positive.
That's it.
Okay, before you sit down, doctor, I just have a few questions. So you said that HCG requires a prescription, correct?
The injecting, yes.
Does Planned Parenthood have the authorization to write those prescriptions, as far as you know, in Arizona anyway?
I can't imagine any reason why they would. It's a drug that's used to induce ovulation, so it's used in infertility patients.
Okay,
Planned Parenthood doesn't normally do infertility.
I understand, but that wasn't my question. My question was, are the medical doctors there able to write a prescription for it if they chose to, if they deemed it medically necessary?
Yes,
Okay. Did you review either the Planned Parenthood records from Mission Viejo or Los Angeles?
No.
Okay. Follow up to the court's questions.
Nothing. Thank you, Judge.
Follow up to court's questions. Thank you, doctor. You can step down. And counsels, before we call the next witness up, just so that